Okay, let's dive right into this. Welcome to the Explainer. Today, we're decoding what I like to call the lifeline. You know, if you've ever actually looked at a fetal heart monitor in a delivery room, you've probably seen what looks like a totally chaotic jumble of squiggly lines. But to the trained eye, those squiggles literally dictate split-second life and death decisions for both the mother and the baby. So today, we're going to break down exactly how to read those hidden signals. Here is our roadmap for today. We'll start with decoding fetal heart monitoring, then look at the anatomy of a contraction. Next, we'll check out accelerations. Those are the good signs. Followed by the 3 types of drops: early decelerations, variable decelerations, and finally, the most critical, late decelerations.
All right, Section 1, Decoding Fetal Heart Monitoring. Before we can even try to read the monitor, we kind of need to know how we're getting this data in the first place, right? It doesn't just magically appear. We basically have 2 ways to do this. First up is internal monitoring. This involves inserting a spiral electrode up through the cervix and attaching it right to the baby's scalp. I know, it sounds super intense, and yeah, it is invasive to both the patient and the baby, but it is incredibly reliable. On the flip side, we have external monitoring. This uses an ultrasound transducer strapped right across the mom's belly. Much less invasive, which is awesome, but the catch? It trades off some reliability. If the baby shifts position, well, you might lose the signal.
110 to 160. Remember those numbers, because that is your absolutely crucial anchor point. To put that into perspective, that is almost double the resting heart rate of a healthy adult. A completely normal fetal heart rate sits right in that sweet spot between 110 and 160 beats per minute. When you're looking at the top line of the monitor grid, this is represented by that squiggly trending line. Whenever we're evaluating a baby's health during labor, this baseline is always our starting point.
Moving on to Section 2, Anatomy of a Contraction.
So while the top line is tracking the baby, that bottom line tracks the mom's contractions. And let's trace what a physical contraction actually looks like over time, because it's not just a simple on-off switch. It starts with the increment. That's the build-up phase as the contraction comes on. Then it hits the acme, which is just a medical term for the absolute peak. After that comes the decrement, as the tension finally starts to let off, leading right into the relaxation or the rest period. Watching this bottom section is huge because it lets us visually assess how frequent and how intense these contractions are. And that sets the whole stage for how the baby's going to react.
Section 3, Accelerations or Signs of Health.
Let's shift our focus back up to the baby's heart rate. And you know, we can take a breath here, because an acceleration is a wonderfully positive sign. Officially, an acceleration is defined as a temporary increase in a term fetus's heart rate that's greater than 15 beats per minute above the baseline, lasting for at least 15 seconds, but no more than 2 minutes. But what does that actually mean in plain English? Basically, it just means the baby is moving around or reacting really well to the contractions. You absolutely do not need any medical interventions here. Seeing this, it proves the baby is healthy, responding normally, and getting plenty of oxygen. It's exactly what we want to see.
Section 4, Early Decelerations, which relate to head compression.
Now we're moving from increases to dips in the heart rate. But don't panic. This is actually a completely normal sign. And this brilliantly illustrates the mechanical reality of childbirth. The fetal heart rate dips slightly right at the start of a contraction. It literally perfectly mirrors the mother's contraction. When the contraction builds up, the heart rate dips down, and it recovers exactly by the end. So why does this happen? Well, the baby's head is in the birth canal. The contraction temporarily squeezes the head, which then compresses the baby's vagus nerve. That little nerve compression causes a totally harmless dip in the heart rate that bounces back nicely as soon as the contraction eases up. So just continue to monitor and document it, no action required at all.
Section 5, Variable Decelerations, pointing to cord compression.
Okay, here is where things start to change. We are transitioning into the dangerous warning signs. As our source describes it, when mom's contraction happens, all of a sudden, bam, that heart rate, it drops down, and it creates this like V or U-shaped pattern. I really want you to lock in on this visual trick. Variable starts with V. Unlike that smooth mirroring we just saw, this is a sudden, really sharp drop way below that 110 beats per minute baseline. What's happening physically here? Umbilical cord compression. The mother's contraction is literally squeezing the umbilical cord, effectively cutting off the baby's oxygen lifeline. The baby's heart gets incredibly stressed out and the rate just plummets. This is a very bad thing, and it absolutely requires immediate nursing intervention.
Section 6, Late Decelerations, indicating placental insufficiency.
And this leads us to the most severe red alert emergency pattern of all, Notice the key word here, later. The fetal heart rate drops later. Specifically, it only starts dropping after the peak, or that acme of the mother's contraction. And worse, it doesn't recover back to the baseline until well after the mother's contraction is completely over. The cause of this late drop is pretty dire. It's called uteroplacental insufficiency. That is a medical term that basically means the placenta itself is failing to work like it should. It is simply not delivering the oxygen the baby desperately needs to survive the stress of labor.
So when the monitor shows variable or late decelerations, we are faced with a massive problem. The baby is actively losing oxygen. So how do we save the lifeline? We have to shift gears instantly from observation to immediate execution.
We execute these critical, immediate steps, and we do it fast. Step 1. Change the mom's position immediately. Getting her into a kneaded chest or a Trendelenburg position can instantly relieve that physical pressure on the cord. Step 2. Administer 8 to 10 liters of supplemental oxygen via a mask to mom. We need to get more oxygen flowing to that baby right away. Step 3. Stop any Pitocin infusion. Pitocin fuels contractions, and right now those contractions are actively harming the baby, so we shut it off. Step 4. Infuse IV fluids to help provide perfusion to the placenta and immediately get the doctor or midwife in the room. And listen, especially in the case of those late decelerations where the placenta is failing, these steps are really just buying you time to prep for an immediate emergency C-section.
Let's bring this all together. Think of this as your ultimate review sheet, connecting those visual squiggles to the actual physiology. If it's an early deceleration, the heart rate smoothly mirrors the contraction because of head compression. The fix? No intervention needed, just keep watching. If it's a variable deceleration, you'll see that sudden V-shaped drop caused by cord compression. The fix? Yes, you need immediate intervention. And if it's a late deceleration, dropping after the peak, that means placental insufficiency. The fix? Absolutely. Immediate intervention and prep for a C-section.
It's honestly incredible how much data is hidden right there in plain sight. I mean, if these simple, chaotic, squiggly lines on a piece of grid paper can literally dictate life and death in a matter of minutes, how confident are you in reading the unwritten signals of the human body? Understanding these patterns, it isn't just about passing some nursing exam, it's about understanding the very mechanics of how we ensure a safe arrival into this world. Take these concepts with you, keep learning, and hey, thank you so much for joining me on this explainer.